Hello, everyone. Welcome to our monthly informational webinar for bariatric surgery in Tijuana, Mexico. I'm just waiting a few more um, minutes to make sure everyone is joining and we can get started. Um, just making sure that everyone knows what we're doing today. If you have not submitted a health questionnaire on our website, please go ahead and do that. If you have submitted it before, you don't need to redo it. As a new HQ, please select Dr. Christian Rodriguez because the raffle that we are doing today is for Dr. Rodriguez. And at one point, before we do start answering your questions at the end, I would release the Zoom poll, and that's something you need to do to participate in our raffle. And you need to be present to the end of the webinar, and we draw a winner name at the end that would qualify for $2,000 off our surgery package for Dr. Christian Rodriguez. Okay, so we are going to continue again for people who just joined. We have a raffle for $2,000 off of surgery package, and we would do that at the end. Make sure that you see you attend all the way to the end. You have a health questionnaire submitted in our website, whether you do it today as the first time or you have one in the past. And do the Zoom poll when I release it right before question and answers. And we do the raffle at the end. We will try to cover as much as we can on the questions that we feel that patients usually ask. However, if there is anything unanswered, we can cover it at the end. Please make sure you pay attention so we don't have to answer the same question again. So today we have Dr. Rodriguez as our surgeon that is covering our medical part of the presentation. And it's ironic because I am actually in Tijuana from Hospital Azar joining you, and Dr. Rodriguez is not in Tijuana. He's in Australia, attending the IFSO World Congress in Melbourne. So anyway, so hopefully we have him join us soon. Last time I text him, he was looking for a Wi-Fi to join us. Okay, so the subjects, the topics that we're going to cover today is basically obesity and its risks, health risks, weight loss surgery. What does it do? What's the magic about weight loss surgery that is so effective? And we will talk about our company, MBC, Mexico Bariatric Center. By the way, I did not introduce myself. My name is Ron Ellie. I am the founder and director of Mexico Bariatric Center. And we talk about why MBC and Mexico Bariatric Center new hospital project. We will talk about the support system programs that we have for you. And Dr. Rodriguez at that time would cover all the different options of laparoscopic versus endoscopic versus robotics. And we talk about revision of procedures a little bit. And we cover a little bit on touch base on financing if you need some, and our nutritional program. And then we have our Q&A session. And then we do the Zoom pool and we do the raffle. So we all know what's obesity. It's a disease that is spread all over the world. We are all dealing with it. It's a metabolic disease, and it's a very complex disease. And we know a lot about how this is affecting us, with our lack of activities day to day, or of course, fast food, sugary drinks, all that stuff, ultra processed food, all these are contributing lifestyle that we are day to day dealing with, and stress and everything else we will cover. What are the factors? In the medical community, basically, they look at a formula that you would plug in your height and weight, and it would give you a number that pretty much puts you in a different category. If you are under 25, they're calling normal. Between 25 to 30 is overweight. And after that, it's going to obese, morbidly obese, super morbidly obese, super morbidly obese. One thing about our center is we have no limitation of what BMI we can handle, as long as your BMI is over 30 and some procedures over 28. We can pretty much handle anything. We have even done BMIs of as high as 110. Okay, we talked about that, our comfort eating, stress, lack of physical activity, ultra-processed food. We are used to having large meals, and when basically when our, what they call them, adipose tissue or fat cells, right? In our fat cells or adipose tissues, when we gain weight, not only the size and the numbers change, the structure, the chemical composition is also changing. And we see it in this picture, how it's changing. As a result of these changes, there comes all these complications, right? Insensitivity to insulin, diabetes type 2, insensitivity to leptin. We don't get the satiety from the food that we eat. Insensitivity to therapies, to vaccination, to what they call metabolic resistance, which means, as we age, our muscles don't respond well to the protein intake and exercises, especially resistance exercising. And that is happening when we gain weight. So the same situation, which means metabolic resistance happens. And no matter how much protein we take, how much exercise we do, the body, the muscles don't respond to that. So that's a huge problem too. And well, basically, these are the items I was covering. And then comes all the different risk factors that comes with obesity. In US alone, about 40% of adults are in the category of more BMI of more than 30, which is obesity. Problem is huge. There are other, of course, countries that they could be, the percentage would be higher, but the total, because of population, it's a big problem in the US. So this animation shows when we gain weight, what happens in our lungs. So that's like a little animation of one of the problems when we gain weight. And then again, like I mentioned, we all know diabetes type 2, heart problems, blood pressure problems, impaired immune system, inflammation. Inflammation is huge. During the COVID pandemic, we learned that being obese and overweight is not a good thing, because you end up being in a hospital, you end up being ICU, and there is a more chance of death because there are more fat cells that coronavirus can attach itself to. So the cure for obesity at this present time is bariatric or weight loss surgery. Diet and exercise is great. We always have to be active. We always have to eat well. But if you have extra fat in the body and your BMI is high, it's not a long-term solution, and we will see why. Then it's the concept of taking a pill or an injection to get rid of your fat. It is becoming better, but still is not a long-term solution. Even with Ozempic type of injections or medications, you still have to take this indefinitely. This is how our body reacts to diet and exercise. And basically, we cannot get to our weight goal, or if we do, it's hard to maintain it because your metabolism goes down, your hunger goes up, your satiety goes down. And these are like hurdle of reaching the goal weight. So what does bariatric surgery do that diet and exercise doesn't? Bariatric surgery resets our metabolic system. And that's a difference between diet and exercise alone and bariatric surgery. Let's say Robert is at 250 pounds, right? There is an interaction between our hormones and our brain. And that's all the hormones and the interaction is setting our weight. And let's say this person, Robert, has been in this weight for a while. So his body, his brain, his gut hormones, other hormones are interacting around that weight, which we call it body's thermostat or set point. If Robert is going to go on strict diet and boot camp type of exercise, and let's say he manages to lose 75 pounds, but guess what? Body constantly is trying to bring him back to the 250 pounds because that's what he was operating at and is used to. So what happens is he gets more hungry and his metabolism goes down. So he's resisting to be at the 175, wants to pull him back to 250. The bariatric surgery, however, resets your body because it manipulates your hormones. It reduces your hunger hormones. It changes so many different hormones that we're going to see in a minute, that the minute you wake up from the surgery, your brain is seeing you at a lower weight. So as a result, you won't be as hungry and your metabolism goes up. So that's the magic of bariatric surgery. That's how it works. We talked about the hormones that change as a result of bariatric and metabolic procedures. See how many of them are changing. And these are just the ones that recently the scientists figured out. I'm sure there are more involved, but it's a complicated system that it changes your hunger hormones, your GLP-1 and GIP and PYY and amylin, and you see how many different hormones are changed. Now the pharmaceuticals are trying with Ozempic, Mounjaro, Wegovy to simulate some of the effect of the bariatric surgery by putting, well, Ozempic has GLP-1 and then Mounjaro has GLP-1 and GIP. So, but you're injecting basically man-made hormones in your body to reduce your weight by simulating some of the effects of metabolic and bariatric surgery. And remember, the other component that bariatric surgery gives you is the restriction, which means it limits your food intake, which is missing in the injections, right? So that's why it's not long-term. And of course, you know, this is a new medication. We don't know what the side effects are. Every day you hear some, you know, news like, oh, you get irreversible vision loss, or, you know, if you have thyroid problem, you can't even take it. Of course, your kidney, all that stuff. Loss of muscle mass, again, the people who are losing weight with Ozempic lose 60% more muscle than people who are losing weight any other way. So your muscle mass is gone. So if you look at efficiency or efficacy of different options, treatment options we have for weight loss at this time, you see that diet and exercise only works for a small population. And Ozempic is about 5 to 10%. And then there is a class of what we call endoscopic procedures, which is like a gastric balloon, ESG, which is what we call endo sleeve. They're covering more percentage of the population. And then the ultimate basically gold standard, which is bariatric surgery, like gastric sleeve, bypass, duodenal switches. So the question is, how do I get this life-changing procedure? If your insurance, let's say in US, covers you, great. Sometimes the deductibles or the processes that they make you go through, it's incredibly hard or expensive. So either you are underinsured or uninsured, the medical tourism is your answer. For Canadians, for example, yes, it's free, but at least 2, 5, 10 years of wait to get this life-changing procedure. And this is something that we are offering in what we call medical tourism at a fraction of the cost of where you live. When you're looking to go through medical tourism, you need to look into a coordinating companies like NBC, because we take care of all the travel dynamic, from pickup from the airport, pickup from the hotel, take you to the hospital, doing all that. And what it gives you is peace of mind. You don't have to worry about where do I stay? What do I do next? Everything is planned for you. And that's the difference. You going with a company that knows what to do. It offers all the conveniences for you. And all you have to do is show up in the airport, and the rest is on us. We will talk more about why you should choose Mexico Bariatric Center. Our certified, top board certified surgeons with huge amount of experience, with our experience in medical tourism, with our reviews, with our quality care, the way we treat you when you're down here from the time you contact us. I want to say a little bit about what is the difference between experienced surgeon and inexperienced surgeon. We see that right now, a lot of the assistant surgeons are starting on their own, making a little company. But what I always compare this to is a pilot. The pilot with so little hours of flight cannot handle the complex situations or emergency situations that pilot can enter. That's why you need a pilot to have the experience, and you're not risking your life. Most of the time, maybe nothing happens, but it's just that one time that the inexperienced pilot or surgeon can cause your death and risk your life. So that's why you want to go with the experienced surgeon, like we have. All the items that I was talking to and more are here. Our reputation, years in this medical tourism space, the surgeons we use, they're not just a name. They do the surgery themselves. The experience, the range of procedures that we offer. We offer anything from endo to laparoscopic. We even starting to do robotics. Of course, robotics and laparoscopic are the same. It's just done a little differently with a machine instead of the surgeon doing the manipulation by himself or herself. We've been active educating people with webinars, seminars for years. We offer medical tourism insurance coverage. I've been in this industry since 2007 myself. In 2012, NBC started NBC. We support you before and after. Our packages are all inclusive, and there's so many things that you can offer. So Another situation that helps you by going to MBC is, let's say the surgeon that is inexperienced or is limited with its skills can only offer you certain type of surgeries. Most of the time we see they can't do bypass, or of course the duodenal switch is out of the question, nobody can do it. And then when you actually go there, they may even qualify you for bypass, but when you get there, they convince you that's not a good option for you. Let's do sleeve because that's all they can do. So you're getting a surgery that is not good for you. It's not suitable for your situation. For us, we can offer you anything from endoscopic to laparoscopic that fits your situation best. We want to give you the best for you. We're not limiting you because our surgeons can only do little. So that's something you want to worry about. Like we see these standalone surgeons right now, that they are very limited in what type of surgeries they can offer. Even the ones that are experienced, they're still very limited. So what they do is they're giving you a surgery that is not suitable for you. Is like putting a jacket on you that is not your size. And because it's internal, they changing your internal, rerouting your intestine or stomach smaller. This can affect you for the rest of your life. So be aware of that. Again, they're doing some Instagram posting. Who knows where the before after pictures came? Was this edited? Was this somebody put his or her friend in a backyard and took a testimonial, and that person is not even a patient, and put it on the Facebook? So you have to remember, the social media is great, but do your research. See who is behind all this. A nice website, a nice Instagram doesn't mean the credibility of that organization. Like NBC, you know who the owner is. I'm always been around. You know who I am. You see me when you come to Tijuana in Hyatt with driving. I'm around. You see me. It's not like some investor or some kind of a name that it's obscure. So we talked about NBC. Just a moment. We are a U.S. corporation. Our main office is in Sacramento. Actually, some patients local, they come to our office and pick up stuff, pick up their application. So we are there. We are present. Our mission has been providing top quality procedures at affordable prices. Our prices for what we offer is the best in class. It's very affordable. In our efforts to provide top quality services to you, we started Project Hospital Azar in 2021, something that I dreamed of for years, finally is materializing, and we should be very, very close to start this. With 3 floors of over 35,000 square feet of patient's room and operating rooms. We have 4 operating rooms, state-of-the-art technology. The technology we're using for sterilization, for the OR, it's the state-of-the-art, is the best in class. And you see some of the pictures of our space. some of the pictures of the OR. These are not just edited pictures. These are real. Okay, so continuing with this, we have over 12 years of experience. We've done over 25,000 successful surgeries that right now we have 5 top quality bariatric surgeons. Our processes are very simple. You submit a health questionnaire that I already said at the beginning. If you don't have one, please submit one by going to mexicobariatriccenter.com/health-questionnaire. We get your approval and you're ready to book. You can even book yourself online. You can find a date, pay the deposit, you're on the calendar. After that, all you have to do is arrange for your trip to come to San Diego International Airport and basically make sure you have your passport, all the other paperwork that you need. Our packages, like I said, are inclusive. As you see, you stay 2 nights, 3 nights in the hospital, or 1 night, depends on what procedure you get. And all the medications, everything is included. We offer what we call a medical tourism insurance as an optional feature that you get very affordable insurance as well. For support is a huge part of this journey because you're getting this tool, you're acquiring a tool that you can work with to lose weight. But how you go about it is important, and the support you have is important. We have so many different Facebook groups, with the main one having over 12,000 past patients. And you can get support before and after. Of course, our staff always around. Our nutritionist is always around. As you see, we do all different types of events, webinars that can help you before and after, pre-op and post-op. Our affiliates are past patients that are helping us support you. These are just a few of them. Sarita, Rena, Dawn, Kelly, Jamie. We're actually getting few more soon, and this is what you're getting from us. Sarita and Rena do the podcast regularly. It's very informative, and I suggest you get on those. As far as raffle, I explained at the beginning, if you have not filled out a health questionnaire online, please go ahead and do that. If you did before, you don't need to submit a new. I would release the Zoom poll before our Q&A session. Please go ahead and do that. Then you are eligible to watch by watching the webinar to the end to be in the raffle, which we do at the end. I mentioned about our bariatric surgeon. Look at this team that we have. Basically, that's why we can cover all these different procedures, because we have expertise of all these different people, different surgeons that have contributed to our program. Dr. Miguel Montalvo Alejandro Gutierrez is our chief surgeon. Dr. Rodriguez Lopez, that I hope that can join us today. He's still probably looking for a Wi-Fi from Australia. And Dr. Jacqueline Osuna. Jacqueline Osuna, she started working with me in 2010, before even NBC started. She's a very experienced, skilled surgeon. Dr. Jesus Ceja, They're all well-respected, well-educated. This is another plus that we offer, that we
Hello,
are.
Ron. This is Dr. Rodriguez. How are you?
Dr. Rodriguez, hello, how are you?
Everything's perfect. I'm just here, okay?
Okay,
I'm
okay,
just right.
great.
Sorry.
All right. All right, we'll let you talk in a minute. So basically, you are getting the support of our surgeon liaison, and we have complex routines and procedures that connect you based on your situation with the best surgeon. Our surgeon liaison is monitoring the traffic of your health questionnaires going to these surgeons. And this is the system that made us be so successful. We're not just a fly-by company, you know, we have developed these routines and complex procedures with computers and whatnot to get you the best option for you. We use few hotels. One of them is Hyatt, which is one of the highest in demand in Tijuana. And but basically, you know, this is just few pictures. So what happens is when you arrive, you stay in the hotel the first night, your companion stays with you, and they have a great breakfast that your companion can have the next day. You have the popsicle, jello, and broth, of course. As far as medication, if you're taking any medication on a regular basis, we will let you know when to stop and start. In general, don't take any blood thinners 1 week before surgery, no NSAIDs, and stop smoking. That's very important. The sooner you stop smoking before and after, the better your outcome. And if you're on an Ozempic, we want you to stop at least 3 weeks before, 2 to 3 weeks before surgery. If you're taking any medication on a regular basis, please bring the bottle with you. When you're flying or driving to San Diego, you meet our driver. They call you the day before your departure, and they tell you, they introduce themselves. We want you to arrive before 12 p.m. and your departure should be after 2 p.m., not so much after, so you don't wait too long in the airport. As far as when San Diego International Airport, it's not huge, it's not overwhelming. Whether you're in Terminal 1 or Terminal 2, Terminal 1 is going through some renovation and should be ready, I think, in 25, but is a little mess. But still, you know, you get your suitcase. Please pack light and just take your suitcase. If you need a carry-on, you don't even have to wait for that. You come out, you tell the driver which letter on the sidewalk you are, and they come up pick you up. When you arrive, we do all the tests that we need to do, and we will take you to hotel to relax and be ready for the next day. Again, you get broth, jello, ice chips before surgery, and your companion will have the free breakfast, like I mentioned. On the date of the surgery, they tell you what time to show up, and they pick you up, take you to the hospital, and you are on your way to get on the losing bench. So you stay there for 1, 2, or 3 nights based on your procedure. We do all the tests, make sure you're good to go, and you can stay longer if you like, or go back home. You can also have the option of coming a day before or stay one day after if your flights are not matching the times that we're picking you up. So let's say if you're coming after 12, maybe 4 p.m., 6 p.m., just to stay in San Diego, stay in Hampton Inn. We have a special rate for our patients. You can mention our name and they would honor that. And the same thing for after. If your flight is at odd times, you can stay one night in Hampton Inn and then go the next day with the shuttle to the airport and back. Again, because we have different surgical teams, we manage their load, and every day we give them enough surgery so they won't get overwhelmed, and they take time off, they get vacations, because it's not just that one surgeon doing all the work. We have different teams. And that's one of the contributing factors to our success and our complication rate being so low. Okay, so Dr. Christian Rodriguez, he is our super surgeon. He's actually teaching, he's a proctor in Mexico. He's teaching other surgeons how to perform surgeries. There are surgeons coming from all over the world. Just watch him do these complex procedures that he does. He's a very knowledgeable, skilled, and experienced surgeon, and a very kind human being. And we have pleasure to have him today. Like I mentioned, he is joining us from Australia. He is in a IFSO International Congress. Again, I don't need to explain more. He's well known for his hello, nice to see your face. I'm going to let him. Well, first of all, if you want to tell us more about how things are going in Australia, what's the weather like, and then you can explain all these different procedures for us. Thank you.
Thank you, Ron. Hello, everyone. I'm really glad to be here with you. Right now, I am in the International Bariatric Congress. Here, we talk about all the new procedures. We always must be in learning what is the best option for our patients. And right now, I'm here in Australia, learning, teaching, because I am a teacher in this Congress. Right now, I'm talking about the duodenal switch. That is the procedure that we are expert. Mexico Bariatric Center probably is the more expert company with duodenal switch in the world. The numbers that we have, the experience that we have, are the best way to tell you that you are in a good hands. Okay, so thank you so much for that introduction, Ron. Right now we're going to talk about the options in weight loss surgery. Everybody is different. Everybody needs a different tool to improve the health. So that's why Mexico Bariatric Centers have several options for you, and we can go from endoscopic procedures to surgical procedures. Endoscopic procedures are the right now are growing. We have two options. We have the balloon, and we have the suture, endosuture techniques. In the endosuture techniques, we have the endoscopic sleeve, and we have the TOR, that patients that already have a bypass. We can do a tune-up of the pouch and the anastomosis with endosuture technique without surgery. The best patients for these endoscopic procedures are patients with BMI around 30, okay? From 70 to 30, 32 are the best patients for endoscopic procedures. But also we have the surgical procedures. That is the most important part in weight loss surgery, because we can have long-term results that, and we offer all the procedures that are in the bariatric field. I'm so happy to tell you that MBC, Mexico Bariatric Center, are one of the most important companies that offer all the American procedures that are available, that are accepted in the America. So we have from gastric sleeve, gastric bypass, mini bypass. We have the duodenal switch, the traditional duodenal switch, and also we have the one anastomosis duodenal switch, better known as SATIS, that right now probably is the most important weight loss surgery in this moment. Everybody's talking about the duodenal switch, and that is why I'm here in Australia.
Just if you want to touch base on if you could touch base on the robotics that we're going to be offering soon also.
Yes, of course. We are so happy to tell you that soon we're gonna do all the surgical procedures from gastric sleeve, bypass, and duodenal switch in robotic technique. Robotics are available in Tijuana, in Mexico, and our company, Mexico Bariatric Center, is gonna be offering for you to have another option to have more technology in robotics. Probably in the next months, we're gonna have the robotics available for you, and it's gonna improve a lot of things, and we're gonna give you a better service. So this is the gastric sleeve. What happened in the gastric sleeve? In gastric sleeve, then what we want to do is make the stomach smaller, but we need to remove the 70 to 80% of the stomach. We need to cut the stomach, and we have to remove the 80 or 70% out of the body. In that part of the stomach that we remove, we produce the ghrelin hormone that is gonna help you to be more, gonna be easier to do the diets, because in that part of the stomach, the ghrelin hormone is the part of the hungry hormone, is the part of the body that produces the hungry hormone. And if we remove that part, the post-op with the diet is gonna be much easier. So that's why right now the gastric sleeve is the most important surgery in weight loss surgery. Probably around the world, everybody is doing gastric sleeve because it is a very important surgery. Also, we can do this technique only with one incision. We can do it everything through the belly button. Why we want to do a single incision is aesthetic. If you don't want scars in your abdominal wall, the single incision could be an option because everything's gonna be in the belly button. So this is an aesthetic technique, but the gastric sleeve is gonna be the same as the traditional sleeve. The only benefit is gonna be aesthetic, okay? And everybody wants aesthetics. So if you are around 30 to 45 BMI, we can do a single incision gastric sleeve. And if you don't want scars, this is gonna be the best option for you. The endoscopic sleeve. This is not a surgery. What we do is we introduce an endoscope. We introduce a camera through your mouth. We get inside of your stomach. We do suturing. And the main in this technique is to shrink your stomach with sutures. So you're gonna feel full with small amounts because it's gonna be like it's gonna simulate like a gastric sleeve technique, traditional with surgery, but we're not gonna cut anything. We only want to shrink the stomach with sutures. This is a novel technique. The weight loss results are not the same. I need to tell you that if you are around 25 to 32, it's gonna be a good option for you. But if your BMI is higher than 32, probably this is not gonna be the best technique to have long-term results, okay? But the main benefit is that it's not a surgical technique, no scars, and the risks are lower because we're not gonna cut anything. So this is an option that we have. We have around 4 years during this technique, and if you are BMI from 25 to 32, you're gonna have good results with this. the bypass. The bypass is the gold standard in weight loss surgery. In this technique, we combine two techniques. We want to do your stomach smaller, more smaller than the gastric sleeve, and also we need to reconnect the small bowel. If we do that, we have a powerful weight loss surgery when you're gonna feel full with small amounts, and also you're not gonna absorb all the food that you eat. So this is the way that the gastric bypass works, and probably is one of the most important surgeries in weight loss surgery. If your BMI is higher than 40 to around 50, 55, probably gastric bypass is the best option for you. Also, if you have acid reflux, these techniques can help you to improve all the acid reflux symptoms. When you have a previous gastric sleeve, the gastric bypass could be a revisional surgery for your gastric sleeve, and it can help you to improve the weight loss surgery. So what is the best surgery for me? We need to see your BMI. The BMI is really, really important. If your BMI is higher than 30 and between 30 to 40, probably gastric sleeve is gonna be the best option for you. If your BMI is higher than 35 and goes to 55, probably gastric bypass is gonna be a best option for you, talking about the long-term results. Weight loss surgery has about 70 years in the medical field. The result says that if your BMI is higher than 35 or 40, probably the best option is gonna be the gastric bypass. Also, something really, really important is if you have acid reflux, probably the gastric bypass is gonna be the only option for you to improve the acid reflux. If you have metabolic disease like diabetes, high blood pressure, the gastric bypass can give you a better option to control all that disease, okay? So, but if your BMI is lower than 35, from 30 to 35, probably the gastric bypass, the gastric sleeve is gonna be the best option. If you don't have acid reflux, we can do a gastric sleeve. And if you don't have high blood pressure and diabetes, the gastric sleeve could be enough, okay? The mini gastric bypass. The traditional gastric bypass has two anastomoses, one to the stomach, another between a small bowel to a small bowel. So a newer technique is the mini gastric bypass that has one anastomosis. It's only we reconnect one part of the small bowel to the stomach, and this gives us a lower risk of complications. This gives us a good weight loss results. This gives us a better control of diabetes and high blood pressure, but what it doesn't give us is to control the acid reflux. So this is a really good technique, but if you have acid reflux, probably mini gastric bypass is not gonna be the answer. Probably we need to go to the traditional gastric bypass. But if you don't have acid reflux, the mini gastric bypass is gonna be a good option if your BMI is between 40 to 55. So talking about the bypass, we have gastric bypass traditional or Aaron White gastric bypass, and we have the mini gastric bypass. For BMI, probably gonna be the same, but the most important part is the acid reflux and ulcers. You have GERD symptoms, acid reflux, the mini bypass is not gonna be the best option. We need to go to traditional gastric bypass. But traditional bypass is a bigger surgery. We have two anastomosis, and that gives us a bigger risk. And one of the risks in traditional bypass is internal hernia, okay? So we also do our technique to prevent internal hernia, but it's one of the risks of this technique in traditional bypass something that we don't have in mini gastric bypass. Well, duodenal switch for me is probably the best surgery in weight loss surgery because we have a restriction procedure that is the gastric bypass. Sorry, is the gastric sleeve. That is one of the most important surgeries in the world. And we combine the gastric sleeve with a reconnection of the small bowel. But the most important part versus gastric bypass is in duodenal switch, we preserve the pyloric valve. When we preserve this part of the digestive system, we do a better surgery. We do more physiological surgery because we can prevent symptoms like dumping symptoms. Also, we can prevent a little bit of malnutrition because we're gonna preserve a really important part of the body that is the pyloric, that is above, that is the pyloric valve, and also probably this surgery is designed to patients with BMI between higher than 50. Okay, we can have a really good results. Patients with that need a big tool for weight loss surgery. Also, we can do this surgery for revisional after gastric sleeve, and we are. This technique is really important for me and for the company because probably we have the record in the world with the most duodenal switch surgeries done in the world. Probably Mexico Bariatric Center has that record, and I can tell you that we are really experienced surgeons with this technique. Okay, we're really recognized in the world with this technique, and also probably we have the patients with more comorbidities, with more disease in obesity that we treat with this technique, having really good results. PCOS, it is a hormonal disease that many women in the world has and is related to overweight and obesity. When we do weight loss surgery, we can control the PCOS syndrome. Our patients with this disease have a lot of problems during pregnancy. It's really hard to get a baby with this syndrome. And when we do weight loss surgery, when we do bariatric surgery, we can see that all of our patients improve a lot. They can have babies. They can have a real hormonal control. This is something really important that I like with weight loss surgery, that we have a lot of improvement with PCOS. So if you have PCOS and it's really hard to control that hormone disease, that weight loss surgery can help you a lot.
So, Dr. Rodriguez, if you want to just touch base on how soon they can go back to work, how soon they can do heavy lifting,
Yes.
heavy exercise,
So we do all our procedures with laparoscopic technique, and really soon we're going to do it with robotic technique. And the most important part in this technique is we do little incisions. Our smallest incision size is about 5 millimeters, and our biggest incision size is like 1 inch size. So what we can have with this technique is a really fast recovery time, because we can do a big surgery with little incisions. So after 1 week, probably you're gonna be recovery about the 70%. After 10 days, a lot of our patients can go back to office work. They are like 80% of recovery, and after 10 or 14 days, they are like 95% of recovery, and they can go back to the normal life, or they can back to job. If you want to do exercise, you can start walking after 7 to 10 days. You can start jogging after 3 weeks. And if you want to do heavy lifting, probably you can start after 4 to 5 weeks after surgery. Everybody's different. It will depend of a lot of things, but probably that can be our numbers.
Okay, well, I appreciate that. You know, I know you're tight schedule. It's always a pleasure and honor to have you, and we are really honored to be able to work with you in our center. I'm going to take over from here. So basically, COVID is becoming doing a little comeback. So please make
I just
sure.
want to, Ron, thank you so much. And I just want to say goodbye because I need to go back to the meeting.
Okay.
And I want to tell our patients, everybody that is listening to the webinar, that MBC is one of the most solid companies in weight loss surgery. Our new hospital is gonna be top. The surgeons are top, and we're gonna take good care of you. Okay.
Yes, again, it's our honor to be able to have you in our team. Thank you so much.
Thank you so much. Bye bye,
Okay.
everybody.
Thank you so much. Goodbye. There you go. So, yes. So again, make sure you do your COVID test before you come to us for yourself and your companion. Our packages are very affordable, but if you need to borrow money, we have super money and e-financing for Canadians. We work with Medicard. Always look into the bank if you have good relationship with your bank. Credit unions, if you have that, those are great places to look for a loan. Of course, you know, SoFi, those places. Just make sure you don't apply for too many places at one time, because it would hit your credit score. As far as one of the pluses going with us is you get a deep discount in medical tourism insurance coverage. With $179, you get a coverage for complication, any unsuccessful outcome. If there is an interruption in your travel because of complication, you get reimbursement, and up to 45 days after the procedure, this insurance covers you. So it's a huge deal. I want everybody to take advantage of that. Our nutrition program is solid. Christian has been doing a great job supporting patients, doing pre-op, post-op webinars. He would soon have a program for you guys that could be subscription that you can do, take advantage even of more support, okay? And this is the gist of it. We have Emerge Bariatric vitamins, which is huge for post-op success. You know, we all lose weight, but for long-term success, you need to have the right nutrition, and vitamins are essential. It comes in a soft, chewable, drinkable, and capsules. Okay, so for me to, like I promised you, like I said, we will have a Zoom poll coming out before we get to our Q&A. So this is, I'm going to launch the questionnaire. Please go ahead. There are 4 simple questions. Just go ahead and answer those, please. And since we are waiting, I can probably just walk around the hospital a little bit. This is our administration area, of course. So I'm going to take you a little bit around here. Sorry for the shaking, if any. This is where our labs are, our X-ray, our examination rooms. Just taking you through the nurses station. This is where the patient's rooms are. Let me see if we can have one of the rooms open. So this is what your rooms look like. This is what you see from your room outside. This is basically your bathroom, your shower. Let me make sure I have light here. Very nicely done. All the beds are bariatric with very supportive mattresses. And as you see, that's just a typical room. I'm going to pull this down. There you go. Looks like almost done. Yeah, so this is basically one of the floors. Cleaning crew are cleaning here. We're getting ready to go in line very, very soon. Okay, well, just a little quick tour of the, oh shoot, Martin is calling me. Did I drop? Sorry that I didn't stop the screen sharing too late. Okay, so let's see how we're doing with the poll. Okay, so I think we're continuing right now. Usually, Dr. Rodriguez would have stayed here to answer the questions for us, but we have to do without him because, like you saw, he's in a Congress, very important Congress. He's also not only attending IFSO, he's actually teaching other surgeons in the world to how to do surgeries. This is the caliber of surgeons we have. So look no more, because the surgery you're getting is not the same. You know, you need to have a surgeon that knows what they're doing. So Andrew is asking, what happens if you by yourself and you get emergency? So first of all, by the time you leave the hospital, we're not like keeping you here like an ambulatory procedure. In US, I know they're pushing to even release patients right after the surgery. This is not a simple surgery, so you need to be in the hospital being taken care of. By the time you leave the hospital, you're good to go. If you comply with all the nutrition instructions we give you, all the medication, don't lift heavy weight, don't do extraneous work out, you'll be fine. But if you have emergency, when you go back home, that's something you want to be very fast going to the doctor, making sure you're okay. But while you're here, there is no problem because you're under our care, okay? Basically, people who are attending this webinar, whether you are on the schedule for surgery or not, you're eligible for the raffle. Okay, so how do you decide what type of revisional surgeries you good for after gastric sleeve? Actually, we are thinking to do a webinar soon for just the revisional surgeries. But then anyway, so that's why you do the health questionnaire. That's why you get a chance to talk to the doctor, surgeon before surgery to make sure the procedure you're getting revision to is the best for you. And we always make sure of that. You know, because a lot of the surgeons can't perform SADI or DS, conventional DS, duodenal switch, they always trying to shy you away from that. But honestly, there are published paper after paper that shows 15-year out that the DS or SADI is the best procedure for long-term success. So, and as far as revisional, bypass, mini bypass usually is a good option if you need a revision from sleeve. But again, you can look into SADI. Again, we would make sure the surgeon reviews your HQ and give you the best option. How long do I need to wait to get pregnant? We recommend 1.5 years. The longer you wait, the better. Your body stabilizes, and make sure, because after surgery, you are more prone to get pregnant. So just make sure you take precautions not to get pregnant right after the procedure. Yes, again, you need yeah, so 1.5 years at least to get pregnant after procedure. So we have not seen very many people that they regret having to do the surgery. We see the opposite. They always say, I should have done that sooner. And they're always happy that they get this life-saving, life-changing procedure. You're basically gonna have a better quality of life and you prolong your life. It would add an average from 7 to 10 years to your life. And also the quality of life is huge. you would live a different life. So why not take this step to get there? So when you, right after the surgery, you have the restriction and you cannot eat too much, but then over time, you get adjusted to that. You know, you have to eat well, you have to eat quality food, but you get enough nutrition. And that's why I mentioned about the bariatric vitamins, right? Bariatric vitamins are huge in your success because the things that you can get specifically is in that vitamins. And it's not over-the-counter vitamin. It's something that is made according to ASMBS standards. So as Dr. Rodriguez mentioned, for bypass, good candidate is a BMI of more than 35. Again, we are giving you what's best for you because for us, whether you do gastric sleeve, DS, it doesn't matter. We want to have the best option for you because we are capable of doing it. We see like patients that come to us that they have, let's say, a BMI of 55, but bypass for their situation is the best. Other centers either sign them up, but they get them in Mexico and convince them to go with sleeve, or they can't even do it right off the bat. We are not limited. We could do a BMI of 55 bypass. Again, you know, you get what is best for you. Yes, for this webinar, you need to be with Dr. Rodriguez. We can switch you though. Well, the pain is not big as long as you start walking after the surgery because the gas doesn't pressure against your chest and your shoulder. But everyone is different in pain tolerance, but we don't see patients experience pain in a very high level. So they're very dull pain, but it will go away. So yes, I am in the new hospital right now. And unfortunately, I forgot to stop sharing my screen. I can probably do that another time. If you want, I can go around the hospital again. Yes, so Andrew, yes, the cutting the stomach in the right size, it's coming from the skill and the experience of the surgeons. So when you say, oh, gastric sleeve, not all surgeons do the same gastric sleeve. The one that is more experienced, has the knowledge, has the skills, is going to give you the best. Again, for sleeve to revisional sleeve, it's usually bypass, mini bypass, sometimes DS or SADI. Yes, you can bring a carry-on, not a problem. So okay, so that's a huge, that's a great question. So we want you, especially for people who are coming for revision, to do a blood test. Make sure your hemoglobin levels at 14, maybe 12 minimum. So when you come here, we don't have to deal with your low iron levels, okay? So especially for people who have revisional, if you had surgery before coming for revisional surgery, please do a blood test. A month, few weeks before your surgery. We do blood tests here. Again, our center is going to do a very comprehensive blood test, like I showed you the lab. So So basically, the difference between SADI and regular conventional DS is being two connections versus one. Again, you know, when you have two, there are more chance of complication. Again, down the road, your nutritional deficiency is going to affect. That's why you have to rely on the surgeon to do what's best for your situation. And that's where you get the expertise of surgeons like Dr. Rodriguez to tell you this is the best option for you. So if you have, okay, if you have acid reflux, bypass is a better option. But then again, depends on where the reflux, what is causing the reflux? There's so many factors that causes reflux, okay? Most of the patient, because the acid reflux is coming from extra weight, they do better after the surgery with the sleeve because that factor goes away. But if you have your reflux, some other factors, 10% of the time, you get worse. That's why you have to get the right procedure for you. Mini bypass is like bypass with one connection. The term mini doesn't mean it's very little. It's actually a very aggressive surgery. It's a bypass with one anastomosis, one connection only instead of two. So with gallbladder, if you know your gallbladder is bad, we can remove it during the surgery. Of course, there are extra fee, not very much. If you if you want to let the surgeon decide when you're here to see what kind of do we want to remove it or not, sometimes with the more aggressive surgeries like DS, you may have gallbladder problem down the line. Of course, the sleeve is a surgery. Endo sleeve, like Dr. Rodriguez mentioned, is not a surgery. Is a basically they stitch your stomach and make it smaller. So the volume gets smaller, so you have restriction. But remember, you don't have the hormonal changes that sleeve creates, like a hunger hormone, all the other hormones. Hiatal hernia. So if you have hiatal hernia and you know it, of course you tell your surgeon, but they also check during the surgery. If it needs to be repaired, we repair it, and we just charge you, I think, very minimal, like $395, something like that. But that really is important to fix the hiatal hernia with sleep because you're going to get reflux if you don't fix that. Of course, robotics will be expensive, but yes, we can start offering soon robotics for you. Just a moment. So sorry, I had to attend something here. Again, you know, So Brooke is asking, I'm a BMI of 42, just want to do endo. Yeah, so yeah, Dr. Gutierrez doesn't do endo, but here's the thing. Like you saw the pyramid, right? So lifestyle changes, or level of activity, our diet, these are all important. How disciplined we are, that's huge. So gastric balloon works for some people, not for everybody, but it's not like, maybe it's a good option for that small percentage. So you have to see what is it that best work for you to reach your goal weight. Is it a balloon? Is it endo sleeve? Or you need more aggressive procedure like duodenal switch, right? So these are all factors. Yeah. Single incision usually needs a lower BMI. Sometimes they can do a 42, but not often. Again, depends on your abdominal cavity too, how much room you have in there. So you can sign up for single incision if you want. And then when you come here, they may not be able to do it, but then they tell you we just have to do a regular sleeve. That's the thing. Some of the questions you guys are asking is really, I would rather not answer, or is really a medical question for Dr. Rodriguez. Unfortunately, we couldn't have him all the way to the end because he was in the Congress. So if you don't get your question answered, please circle back to us, to your coordinator, and we can either have our surgeon liaison answer it, or we ask the doctor get the answer for you. Sorry for that. So your sleeve, your gastric sleeve pouch or sleeve does not stretch to its original size. So this is a misconception that I'm going to stretch my stomach again. It's never going to happen. C-section and things like that don't interfere with the surgery. If you have some kind of a special needs that, like your Jennifer is mentioning, your belly shaped differently, please make sure you get pictures done, send it to your coordinators, and we would run it by the surgeon. Make sure you're getting the right option. Again, we see a lot of the patients with the high BMI, very heavy patients, they lose 100 pounds. And again, sleep is a great option. You just have to see what works for you. That's why you are consulting with your surgeons, right? To see this is the best option. You also have to look at how old you are, what lifestyle you have, what you're capable of doing, what's your discipline level, and that determines what is best for you. Yes. Again, stay tuned for the revisional webinar is coming up. We will cover all these different options for you. Some of the options that no one else can offer. Like, for example, we could do a mini bypass to bypass revision. We could do sometimes a bypass to duodenal switch revision. Not always, again, if we don't be disappointed if we want to do some complicated procedure for you and then you come here and it doesn't happen. These surgeons are doing their best to help patients, and remember that. And if it's possible, they can do it. If not, no one else can do it. As far as blood clots, please make sure you wear compression socks on the way back home, especially if your travel is longer. And, you know, they give you some injection to prevent that. But again, you know, it's your body, how it reacts. Yes, your medical tourism insurance covers 45 days after you leave Mexico. It's just a Zoom call. Yes, please make sure you have passport card or passport books because they're starting to be a little strict about that. So it's better to come equipped. So, you know, sometimes the officers are having a bad day and then just pull over to the secondary. That way you are actually going to be behind. Your people in the van are going to be all losing their flight. So make sure that you are okay. So back to the questions. Yeah, we're hoping the hospital would open very soon, so stay tuned. You know, as far as bringing money, if you bring a credit card in case there are like extra hernia repair or things like that, is needed, it's better. As far as cash, if you want to tip hotel or drivers, just bring some. But dollar is fine because this is a border city and dollar works as well as pesos. Unfortunately, I cannot post the poll again because if I do that, it would erase the original one. Okay, so as it is right now, companions have extensive visiting hours. So the first night you stay in the hotel together, the next day you go to the hospital, they can come and visit you. As it is right now. So right now you can schedule your surgery. We have quite a bit of spaces open, again, because we cap our surgeons' daily surgeries, you may not be able to get that day, but then you can get another date close to it. Your vitamins, you can start maybe a couple weeks after surgery. Okay, that's a huge question. I don't know if they went over. Your pre-op diet depends on your BMI. If your BMI is close to 30, your pre-op diet is only 2-day clear liquid. If your BMI is 50, 60, you need few weeks. It's very simple, just low carb, high protein diet. The better you do on your pre-op diet, the easier the surgery is on you and the surgeon. Okay, about loose skin. Our company who deals with that is called Mexico Cosmetic Center. We actually had a webinar for the first time a couple of weeks ago. Look for that, sign up for webinar. If you need skin removal, you have to wait 1.5 years at least, and you need to have your weight stable at least 6 months. That's the best for the best results. If you need skin removal, just join us in MexicoCosmeticsCenter.com. We will take care of you there. The Canadian patients can use Medicard. That's the company we've been using to give us financing. Okay, so the time you get your approval for the surgery, you can put a deposit, and the rest is due 2 weeks prior, 15 days prior to the surgery. Whether you bring in cash or check, whatever, you just send a picture of the cashier's check 15 days or more before surgery. You can make payments. You can do like a layover. So you can do like every month pay 500 until your surgery, or 1,000. However you want to do, you can make payments toward your surgery as long as it's paid before the surgery time. So we start our surgeries usually around 6 to 7 in the morning, and then the schedule comes the day before. They know who's going first, who's going second, and all that. For these procedures, you don't really need a checkup. The only checkup you need to do is maybe 3 to 6 months, go back to your general physician where you live and have them do a blood test, make sure your vitamins, everything is checked. That's all the follow-ups you need. Yes. The insurance is offered to you, the MTI is at the time of the sign up. So you can pay it and get it covered. So as far as safety in Mexico, so basically our hotel hospital are in the prominent areas of Mexico. Myself, I walk actually actually, let me show you this. I'm going to stop sharing so I can show you. All right, so let me see team. So do you see me more? Stop sharing. So do you guys see me? Let me see. More on your screen now. Okay, so we're gonna try to go around a little bit here. So let's get these. Oops. So this is the office I'm in right now. So if you look, that tall building that is black on the top, it says BBVA. That's behind Hyatt. So we actually see Hyatt from here. So if you see, I usually walk actually from Hyatt to here. This is our building. I'm in the 8th floor. So let me see. So if you see, I guess I was on the mute for some reason. So that tall building, the black building, is behind Hyatt. And Hyatt is a shorter building. So that's where I walk to come here sometimes. So these are prominent areas in the city. And so it's very safe. All right, so let's go around again one more time. So this is basically our administration area where I am. This is where our X-ray lab is. This is our blood test station. They locked it up. They have all the equipment there, ready to go. These are examination rooms here. Again, this is the part of the lab. This is where patients come in. So now I'm going to the nurse station here. And this is where the patients stay. This is what the rooms look like. We can perhaps open up. So this is the view from your room to the outside. I'm in the 8th floor. As you see, the beds, these are all bariatric mattresses. for supporting you when you're here. That's where your companion can visit you here. And basically the bathroom here. This is your shower, your bathroom. So basically that's what you're getting. That's a little bit of Tijuana you see here. Again, you have access this way too. Okay. Go up. That's the other side of town. I hope that you see well. So that's pretty much what you guys are seeing, and that's pretty much a typical room. Oh. All the our certificates here. So going back, right? Okay, so there are some questions that didn't get answered. I'm sorry, we're running out of time. So if you didn't get your question answered, please circle back to us and we'd be more than happy to answer your questions. So the winner of the webinar is Raven Taylor. Raven Taylor, I'm going to let you talk. Please unmute yourself.
Hi.
Hello. Did I say your name right?
Yes. Yeah.
Okay. How are you doing?
I'm doing well, and you?
I'm doing great. So where do you live?
I live in Bolivar, Tennessee, just right outside of Memphis.
Oh, great.
Yes.
All right. Tell us
I'll
about
be-
yourself. How did you hear about us? What's your weight loss journey has been like?
I saw the Mexico Bariatric Center on social media, and I just been doing some research about it. I am interested in getting the sleeve. I think my BMI is like 39 or 40. So
Okay.
I'm looking to lose, I don't know, maybe 70 to 80 pounds. I think according to the US, what are the BMI table or whatever, if you go by your height and everything, I think I'm supposed to be like 125, 130, something like that. But my goal is around 150, 155, and so I'm
How old are you, Raven?
I'm 32.
Okay, that's
Yep.
great.
Yep.
Yeah, if you do this when you're younger, you basically set for the rest of your life. So how soon are you planning to come?
As soon as I can get booked and whatever the procedures are, for me to
Yes.
be able to come
So,
to.
yeah. So let me make sure that I would let coordination know.
Okay.
So you can call us and I make sure they contact you to get you all set up. I appreciate you and everyone else who attended. We appreciate Dr. Rodriguez to join us, and we will look forward to see you guys again. If you again be on alert for our special webinars for cosmetics and for revisional surgeries. Okay, Raven, if you have anything else for me?
I do not know.
Okay, well, thank you so much for attending and good luck. We wish
Thank
you
you.
best. Okay?
Thank you.
All right.
Look forward to seeing y'all.
Yes. Thank you, guys. Have a good day.